Doctors of Reddit, who was the most entitled parent you've seen in the ER? A lot of pediatricians will tell you the hardest part of pediatrics isn't the patients, but their parents. It's difficult to explain to hostile parents that their 6-year-old with the sniffles will be waiting longer than the 6-year-old coughing up blood. We have a specialized children's ER in our state, and many parents bring their children with simple ear infections or colds here instead of their family doctor because they know the ER has senior specialists. It's a huge burden on the public system, especially when they act shocked that they have to wait 4 hours after being triaged and abuse the nurses for it. Their fears are understandable though. They want what is best for their child. I'd take over-involved before under-involved any day of the week. Child abuse and neglect is seen in both ER and outpatients, alongside atypical cases. In outpatients there was a child with significant language delay. She was tested for several things like autism, and it turned out her parents just didn't really speak to her. The father worked a lot, and the mother openly admitted she just wasn't interested, so wouldn't take her to playgroups, the park, talk to her, etc. The mother was extensively interviewed for long-term postpartum depression. Both were screened for mental health or domestic issues. Ultimately they were right, they just weren't interested. The child hadn't been planned, and they just weren't deeply invested in the child-parent relationship. The child was otherwise well looked after in this upper middle class family, but was utterly emotionally neglected. They believed feeding and clothing her was sufficient for normal development. It was bizarre and entitled behavior. Last time I was in the ER, a local news anchor came in. I actually did recognize him. He walked by where we were sitting, and I saw him go up to the check-in area and immediately demand to go straight to triage, and I heard what you'd expect. "Don't you know who I am?" A response I wasn't expecting, but made me laugh. "I do not, and I don't really care." And something like, "I don't want to be waiting with all these sick people, you better not make me wait." To which she told him to have a seat and wait. It was really funny to listen to. It's the second local news personality I've encountered in my life, and both were super loud dicks. I've been on a local channel. If I die from this injury, dozens of people might be mildly annoyed. Not a doctor, but a nurse and a mom. So this took place in an affluent community in South OC, California. When my son was about 5 months old, he was in the hospital for a kidney infection. So a sick baby girl is admitted into the next crib, maybe 3 months old. The father was present when the baby was admitted, then immediately took off. He said something to the effect that he was paying tons of money for his baby to be taken care of in the hospital, so he was going to go home and get a good night's sleep with his wife, who hadn't even bothered to show up. Meanwhile, my husband and I are camped out at our baby's bedside through the night. Keep in mind, this is not a RN-ICU or PICU, just a regular pediatric unit. This is not a locked unit and anyone can come in and out through the night, meaning anyone could come in and pick up their baby and leave. Well, as you can imagine, that poor baby cried all night. The nurse did her best, but with multiple patients to care for, she eventually had to call the parents and demand that one of them come back in to hold their baby. They were not happy. I was blown away that they would just leave their baby like that. My mum and I were sitting in the ER because it had comfortable seats, and a boy about 15 came in with his mum, and he was screaming, crying, and she was yelling. He got the glue that people use for braces on his penis, and a toilet paper roll was stuck to his foreskin. She kept yelling, saying, "He needs ducking help. Rip it off. It's hurting him." My mum and I died because obviously this kid had a wanking accident and the glue was burning his penis. The mum told my mum to shut the duck up, but my mum didn't fight and just kept laughing. Saw a 30-year-old guy who came in with complaint of chest pain. After seeing and examining him, his story sounded like GERD, but cardiac workup was started. Got called away from the module to deal with a teenager who was shot and ended up dying. When I got back, the guy's mom was there and was irate that I hadn't been in to talk to her in the 15 minutes since she arrived. I tried to explain that his workup had already been started. There were other patients in the department who also needed my attention, and many of whom were far more sick. She lost it, basically said she didn't care about anyone else, and her son was the only one who matters. She wouldn't calm down, and was eventually escorted out by security. Nurse here. My colleague was discharging a patient and, in the process, asked if he needed his parking validated. He sneered at her and responded, "I'm on the board of this hospital. I don't need your validation to do anything." Turns out he was a local philanthropist and multimillionaire, and I guess we were supposed to know that. Seems like a weird attitude for a philanthropist. I always assumed they'd be nice. Hell no. Many people who call themselves philanthropists and are doing it for the tax deductions or because they want to be seen as a good persons and not the actual dicks they are. Not a doctor, but I was a patient. I had been hit by a car going 25 and I was on my skateboard. Totally my ducking fault by the way, and I had broken my pelvis. I had originally thought I had just popped my hip out, but I was wrong. Anyway, I go in with my parents, and I'm standing there with crutches because it hurt to sit, and my mother is screaming at these nurses to get me into x-ray because I was obviously in tremendous pain. I was fine. I've had a lot worse, and I calmly hobbled up to the nurse she was yelling at and played the "I don't know who this lady is, and I will calmly wait my turn, I'm very sorry." The nurse gave me a candy bar because I was calm and level-headed, so that was nice. Pretty positive that pelvic fractures are treated as a life-threatening injury in pre-hospital car, so mom was right to be freaking out. I'm now going to refer to all ambulances as pre-hospital cars the same way I refer to lasagna as spaghetti cake. ER nurse here. Had a minor local celebrity show up in the middle of the night for back pain. He had another man with him, so I asked how they were related. The visitor stated that he was the patient's chauffeur and personal assistant. The visitor then proceeded to inform me of the patient's identity, as if I should be grateful to be taking care of this celebrity. Woo. Go him, I guess. Having not grown up in the area where I live now, this meant I had literally no idea who he was. Honestly didn't care and still don't. The visitor also told me that money was no object and that the patient required only the best care, and if that meant a helicopter to a specialist or whatever, they could make it happen. The ER I work in is a large academic medical center with more specialists than it knows what to do with. We get people flown in to see them, not usually the other way around. Spent the rest of the night running back and forth while he screamed bloody murder over his back pain, and his personal assistant followed me around expecting me to cater to his employer's every whim. 1 out of 10. Do not recommend. I'm an EMT, not a doctor. Had a patient once who shriekingly demanded a back massage to calm her nerves. She did not get one. Also of note was the fact that there was nothing detectably physically wrong with her. I used to volunteer at a hospital and got to overhear a nurse doing her best to not headbutt a woman in all pink with a beehive hairstyle and giant tortoise shell sunglasses claiming to be distant relatives of royalty. It was extra hilarious because the nurse was kinda ignorant, so when the woman claimed to be the second half step cousin or some shit of a Duke of Liechtenstein, I got to hear in a deep urban accent, "Lichen what? Liechtenstein? That not a real place now, I need you to go take a seat, hun." Not a doctor, but I work the front desk of a doctor's office. Woman came into her appointment on the 6th floor, but when her appointment was over the elevator was down. She demanded we call the fire department so that they could carry her down the stairs. Was she in for anything that would affect her ability to use the stairs? Oh, not even remotely. Skin irritation. IRC. Going back many years, but my favorite. Me. Inspect child rash, it's impetigo. Mother. What's that? Me. School sores. It's a. Mother literally said, it can't be that. We are itch. Me. Mother. Can we see someone more senior? Me. Get CD consultant to review. Consultant. Hello. Oh, what do we have here? Oh, look, impetigo. Mother stares in disbelief, asks to see a pediatric dermatologist as they can't possibly have a paw disease. ED consultant is a super relaxed guy and says yep and calls our most pediatric skin specialist. He is a big deal in the peds dermatology world and he is our weird rash expert. He comes to review the patient. We watch him enter the cubicle. A couple of minutes later exits, asks for a script pad, scribbles his order, goes back and hands the mother the script, and she profusely thanks him for his time and expertise. She glares at us as she leaves. Dr. Weird Rash Expert turns to us and says, impetigo. I just told her it was a unusual variant that children of wealthy people get when in the tropics. not a doctor, but I had a rather memorable experience. When I was about 21, I began experiencing gallbladder issues. One night, the attack got so bad that I crawled to my roommate's room and asked her to take me to the hospital. As soon as we got there, the nurse immediately took me in for assessment. I was in so much pain that I couldn't talk, so my roommate gave the nurse all my information. The nurse went to get me something for the pain, and my roommate went to call my parents for me, so I was sitting alone in intake for a couple minutes. This lady comes in, literally picks me up by the arm, and leads me back to the waiting area. I didn't even realize this lady wasn't a nurse. All of a sudden, I hear yelling, and I learned later that was transpired was that this lady was actually a patient who was mad that I went to intake before her, led me back to the waiting room, and tried to take my spot in the intake room. She was escorted out by security. Resident doctor. I was working on a surgical ward taking care of the post-op patients. Surgeon calls me to tell me I need to send a script for oxycodone to a young patient who was sent home from theater directly after minor surgery. I have the script faxed over to the pharmacy of the patient. Angry dad calls me next day saying his son is out oxycodone and I need to give him another script. I tried to reason with him that if he's using that much oxycodone he needs medical review before he can be issued another script. Dad wouldn't have it. Said I didn't do my job as a doctor to take care of his kid after the surgery. He then proceeded to file a formal complaint against me. All I did was give his kid a script and told him to see his family doctor if he needs more pain relief. Somehow I had the gut feeling that the patient wasn't the one taking the oxycodone. I was a patient visiting the orthopedics clinic of a major hospital in Minneapolis for a follow-up on my destroyed arm. We were in the lobby waiting when this black guy came out from the rooms dragging his 6 to 7-year-old son. He started screaming and screaming about how the nurse asked him to stop talking on his cell phone on speakerphone when his son was getting examined. He called the front desk ladies 100% innocent, racist cunts over and over, and that the entire hospital was full of racists. Finally, after 4 to 5 minutes of this, security showed up and asked him to leave, and he yelled back, "Y'all racists better not be here when I get back with my gun." I have no idea if they arrested him or let him go, but I was happy to get the hell out of that shithole. I felt so bad for his son. What an absolutely horrible role model. Obligatory, not a doctor, but I worked in a pediatric ED for a bit. Once, at the start of my shift, a mother asked me if I could get a cup of water for her child. Since some patients are supposed to be NPO, I told her I would check with the doctor. Before I could say anything else, the mother screamed, "You ducking useless ginger bitch," and threw her purse at me. She had terrible aim, and her purse split open all over the floor at my feet. I just walked away when she told me to pick it up. She screamed at me one more time, and by now the rest of the unit was just silently staring at her. Security was called, and she eventually had to be escorted out of the building with her kid because she was refusing to leave without her child receiving antibiotics. He was there for a cold, was told to go home and rest. I felt so bad for the kid. She spent the entire day refusing to leave and asking for different drugs for her kid, ranging from penicillin to Percocet, and becoming more and more irate when she was told no. So asking for water and not being told yes straight away set her off. But I was known as GB by my coworkers for the rest of the time I worked there, so got a funny nickname, I guess. You have been visited by the donut doggo. You will be blessed with tasty fresh donuts, but only if you comment, "Much donut, doggo."